lifestyle medicine was the one that called to me. It made the most sense, and it just flowed naturally in my own lifestyle, because I think it's a great profession to take self-accountability for as well. So I work very hard to be able to, walk my talk and practice what I preach.
You have more power over your health than what you've been told. This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. I'm passionate about finding healthy lifestyle solutions to support optimal human health. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life and increase longevity in a big way. Let's get started. Culinary medicine merges the medical training that physicians receive with the training that chefs and health coaches also receive. Dr. Colin Zhu is here to talk to us specifically about culinary medicine, integrative medicine, and his Thrive Formula masterclass. You'll basically learn how to thrive in life with Dr. Zhu. As always, the full bio and the links for my guests are located in the show notes, and I hope that you enjoy this episode. Welcome, Dr. Zhu.
Hello. Hi, Maya. I'm super stoked to be here. Finally.
I want to start off by saying that I'm a big fan of yours, and I feel like I follow almost everything that you do.
Oh.
And it's nice to talk as a fellow podcaster. When you share something, I want to be one of the people that gets a taste of your classes. For example, you did not long ago through one of the apps a audio course. Of course, I read your book. I listened to your podcast. And I recently read an article that you released. So I want to talk about all of that. And I love your branding, by the way, everything
Thank you.
around thriving and Thrive Medicine and your Thrive Formula, I think is very inspirational. And I haven't met anyone else in the field of culinary medicine. So I'm excited that we're going to talk about that. Let's start by learning a little bit about yourself. You know, in the past, you've talked about your mom playing a significant role in terms of really role modeling for you. Putting patients first when it comes to medicine. So tell us about her.
Yeah, for sure. So number one, thank you for having me on. I have much, mutual admiration and respect for you. You and your husband do, such great work and just putting out so much love and service into the world. So definitely, thank you for showing up the way that you do. And I'm happy to be here. So
thank you.
So basically, I'm Colin Zhu. My journey started pretty much out of the womb when my mom started talking to me. Basically, she's, she recounts a lot of stories of growing up, and she's originally from Hong Kong. Both of my parents are immigrants. I'm a first generation immigrant child. And, growing up on the Northeast, we definitely lived, humble beginnings. And, my mother has been a practicing traditional Chinese medical doctor for 4 decades now. She's done acupuncture, traditional Chinese medicine. She now practices more like functional medicine, detox programs, and fasting programs. So, suffice to say, she's a, well of knowledge. And the biggest values that I was taught from her has been compassion, empathy, and really looking at people in a holistic, manner. And, definitely been blessed for that. And to kind of have that perspective from the get-go meant a lot to me, because it allowed me to kind of open my scope of view for life, for, wellness, for health, for people. And so she taught me a lot of, values. And, from that, I was able to kind of flourish and take my life in many various different types of, pathways, which I'm very, humbled to have been on. So she practices, Chinese medicine. I thought I was going to go into medical school blending both Eastern and Western philosophies. Suffice to say, I did not, follow through with that because there was a lot of, every patient that came through our doors battled with some sort of chronic lifestyle related disease, whether it's diabetes, cancer, high blood pressure, heart disease, things like that. And at the time, my alma mater didn't equip me enough to prepare me to be able to take that on. It didn't matter whether someone had a cough or just low back pain. They still had some sort of chronic component or risk factor attached to them. And so, coming from the background that I have came on, I realized that I needed to take other detours. I needed to take a lot of other roads. And even though it was a much longer journey, it was a much longer pathway for myself. It provided me a lot of great lessons, a lot of new doors and opportunities and experiences that I probably wouldn't have experienced otherwise, having gone through a more traditional route. And so, like you said, Maya, I got myself certified in health coaching because I really needed to understand from a different point of view of how to be someone's advocate, how to be someone's cheerleader. And you're not really necessarily taught that in school and training. And I went into culinary school because I wanted to learn more than just nutrition. I wanted to know what food was all about, where it came from, how it was grown, how it's prepared, how to, taste profiles, combined, etc. And then I did that in between medical school and training. And then I just took that education to do various other things. So,
The fact that you have this interest in caring and putting the patient first, I think perhaps many physicians who enter the field have that interest initially, and then reality hits, right? And you're very limited with patients. And so when I learned about this background of yours, mainly because of the influence of your mom, then it made sense. I kind of said, let's define what osteopathic medicine is for
mhm,
people who are may not be as familiar. And you sort of just
sure.
described it, but if you'd like to kind of explain a little bit more, it's just taking the whole person approach, right?
Yeah. So osteopathic medicine is basically doctors who have a DO at the end of their name. So they're not MDs, they're DOs. And they stand for a couple things, either one, doctor of osteopathy, or doctor of osteopathic medicine, both with the same, initials. And basically, it was created by Dr. Andrew Taylor Still, and he was an MD, and he kind of pioneered and founded osteopathy back in the late 1800s, right around the time that basketball was discovered, actually. And you got to love these pioneers, right? So with that, just to make it simple, it's exactly the same as a medical doctor in the United States, right? So we can practice medicine, we can practice surgery, we can do everything. The only difference is that in schooling, you have 300 extra hours of manual manipulation. Basically, we use our hands to be able to diagnose and treat somatic dysfunction. And that's basically a dysregulation, whether it be on the top of the body all the way down to organ level. We're trained and able to sense different variations and irregularities, if you will, on that, tangible physical level. So it's almost like very similar, but not quite similar if you combined, massage therapy and chiropractic, but it goes way beyond, that. So that's the easiest analogies and references I can give to people. But yeah, it's 300 extra training. So in essence, we actually have more training than medical doctors. So I don't know if
That's
that answers your question.
Oh, yes, and I'm glad that you emphasized that. Now, when it comes to culinary medicine, the best way the article that you recently wrote for the Health Science magazine really was so put together in a way that helps someone like myself understand the differences. And I thought that we could kind of explore that topic a little bit, so that our listeners could understand, because you have the strength of both of an actual physician, so you have that knowledge of being a physician, but you also have the training as a chef and also a health coach that helps marry or merge both of those practices to be even more effective with patients. So let's talk a little bit about that. What is culinary medicine?
Yeah, so basically, culinary medicine is, exactly what you said. You're blending pretty much the science of nutrition, with the culinary arts, and its application is really to use food, is medicine and as medicine, whether it's a tool, whether it is a RX or a prescription, and it is really utilizing the understanding of how food can be in a way therapeutic and healing, right? There's a great quote, I forget where it comes from, but basically, I would paraphrase it in a way that, whenever you put something into your mouth, into your system, it either does one or two things. It either feeds health or feeds disease. And so, when you have that kind of perspective on, because if you think about your digestive tract, the only exposure it can get to the outside world is basically whatever you put inside of it, right? And so, in that vein, you have to kind of be a little bit mindful and wise in terms of what you put into it, right? It's kind of like I use a lot of car analogies. And, if you really value and prioritize your car and you want to maintain it, for as long as possible, do you put, higher grade fuel in it, or put in the lowest grade, right? It just depends on how you prioritize it, right? And on the same vein, it's like I kind of feel that most people maintain their cars better than they do their bodies. So I would tell a patient, hey, Mr. Smith, if you kind of think about, cars, a car is everything everyone can relate to, right? So if I were to tell you, you only get one car and you cannot, sell back, buy back, sell out the lease, buy a new one, switch it out. You can't do any of that. And if I were to tell you you only get one car, what would you do? You would do your best to maintain it to the best of your ability. And that's what your physical body, is. And to me, the driver is the mental slash emotional part, the mental health, as you will. And I think more and more now, because of the pandemic, people are understanding that they're not really two separate entities. And for me, it doesn't make sense to separate these things because, they all are housed under one unit, which is your physical body. And, going back to osteopathy, osteopathic medicine knew this from the beginning. And so they knew that's part of their four tenets that, body, mind, and spirit, we have to be able to cater to all three. So yeah, culinary medicine is just but another tool out of our arsenal of tool sets, just like medicine and just like surgery, to be able to offer to someone as part of their therapeutic repertoire.
Now, I've seen you do several food demonstrations. In a patient kind of office setting, how would you take that approach when speaking about nutrition with a patient?
So it depends. Being trained in family medicine and having seen like thousands of patients in family practice, you pretty much meet everyone on the spectrum. So, I've met people who are extreme carnivores to extreme vegans, and everyone in between. And to me, I don't really push, my viewpoints, quote unquote. It's really about, three. It comes down to three things. I teach from a whole food plant based approach, so I tell them just to eat more plants. Okay, and we can afford to eat more plants with little, if no, side effects. 97% of Americans are deficient in fiber, which is one of the most essential nutrients that we don't really talk about. And it really depends on the individual, where they come from, what is their relationship with food, what's their relationship with nutrition, what is our kitchen, how is it set up. Do they work a lot? Do they eat in, eat out, cook for themselves, not cook for themselves? Do they do this with others? It's you have to do some really sit down. You have to sit down with them and talk it out to kind of see where they're at, because if you don't have an understanding of where they're at, you can't really guide them to the next step.
Speaking of that, when you talk about like really interviewing your patients to figure out where they are, one of the things that spoken about is honoring that diversity and their cultural background. So being very sensitive to that so as to not prescribe or provide recipes that are outside of what the individuals are accustomed to, which I really like. That's something that we have to
Mm.
take into consideration.
Yeah, yeah, for sure. I think it's, very important to respect someone's cultural background, ethnicity, and views. And at the end of the day, food means a lot to people on many different levels. And so it's very important to understand, what is their relationship to food and what makes them comfortable, because food is comfort for a lot of us.
hmm Now, also the advantage that you have with your training in culinary medicine is like when I was thinking about a friend of ours that's a dietitian, we were recently having this conversation about how successful she is with one of her clients. But she cannot adjust his medication. So she's put him on the right foods to lower the blood pressure. But now she has to consult or speak with his physician. And you know how that goes when you get more people involved. The difference is that you yourself can do both. You can educate the patient in terms of how nutrition affects their health, and then you can also adjust their medication.
Yeah, yeah, for sure. So currently, I have my own private practice, doing lifestyle medicine consulting, telehealth virtually now. And we have that ability to, de-prescribe. That is pretty much, one of the favorable outcomes of being able to utilize lifestyle medicine, to be able to see the patient. So, we do this with and without the conjunction of their primary doc if they have a primary doc. And at the end of the day, it's really about teamwork. So
Hmm. And by the way, congratulations, you're now part of the plant based telehealth practice. Here on the podcast, I often promote telemedicine. Just I want people to feel comfortable with taking that approach. I know that we're often in our local area asked if we know of plant-based primary physicians or other specialists. And believe it or not, despite the fact that we live in one of the what is it, one of the top four cities, largest cities in Texas, we still have like a small percentage of people, of practitioners that have jumped on board when it comes to plant-based nutrition. So we're very limited. And so for me, the best thing to do is to say to my listeners and other people here, have you ever considered telemedicine? Telehealth is pretty good. It's very convenient. You can be at home. So
yes, yes, I am licensed in Texas and taking new patients. So
are you really? I did not know that. And so that was gonna be my next question. Tell us more, like, where can you practice? Which states?
so currently I reside, I'm working from Southern California. I'm originally from New Jersey. I have license in both of them. So how telemedicine works is you can only see someone in a different state where you're licensed in and where you're physically located in. So if you are physically located in Texas and if I have a license there, then I can see you. Okay. So we have the ability to cross state lines, and to do this once you're able to be licensed. And I think the plus side of the pandemic has been that telemedicine is normalized now. So all my work seeing patients has been virtual. Only this year we are deciding to actually open to see new patients in person, but not quite yet. Later down the line, but yes, I can see. So I have licenses in Texas. I see patients in California, Washington, New Jersey, Connecticut, Florida, and just added the state of West Virginia.
That's wonderful. So and that's really the hardest part is obtaining the license, right? It's not that you don't necessarily
It
wanna,
is. It is.
work with other people in throughout the country.
No, no. As much as we wish, I'm sure all doctors can agree that, we wish there was a national license. But no, no. Politics forbid this.
I know. Ah, I wanted to go back. So in preparation for our conversation, of course, I'm doing research, and one of the things that I was surprised about when it comes to you is that you have been around when it comes to the American College of Lifestyle Medicine and all of that. Very early on, since I think I've heard you say 2013. You were one of the original kind of small group. Were you on the board at the time?
Mhm. We, me and a couple others, we started a board for residents and medical students. It was called, let's see, professionals in training. So we started the first board, me and two or three others. So we started that back in 2013, and that's when lifestyle medicine I felt like was my professional home or professional tribe, and it was really the type of specialty and profession that that called to me. And up until then, I followed a lot of different people. As you can imagine, my mother being, who she is, and I was really open to different types of modalities, right? So I studied and followed, integrative medicine docs. I followed functional medicine docs, not naturopathic. a lot. I followed a lot, and lifestyle medicine was the one that called to me. It made the most sense, and it just flowed naturally in my own lifestyle, because I think it's a great profession to take self accountability for as well. So I work very hard to be able to, walk my talk and practice what I preach.
You are really working to help educate young doctors. It's your hope to get more people to be interested in culinary medicine, not just lifestyle medicine, but choose culinary medicine as a field.
That's a good question. Whether I want people to be more involved in culinary medicine, I think it's important to bring awareness. I think it's important to kind of educate what is out there, because lifestyle medicine is interesting. Because I'm actually about to give a talk to a residency group as well, and in all its different types of applications, it's hard to actually pin down what has been done, what is going on right now, and what has yet to be done. I really enjoy it because there's just so many different types of applications you can use, and you can use to kind of iterate. For me, is not necessarily just about culinary medicine, because to me, similar to my mother, I do, uh, I do make sure that almost every pillar is prioritized as best as possible. Obviously, food nutrition is always a ever evolving field, and profession, and that's one of the that's one of the most exciting things that we talk about at the conference. There's always good food, there's always some latest research or whatever. And but yeah, I think it's also important, just as important, to place emphasis on other things, right? On how do we maximize our physical fitness, to not just be bodybuilders. That's not, to me, that's not really the goal. To work well functionally, right? To not break down, if to kind of like hurt your back from just picking something up from the ground, to reaching something to the cabinet, to remain flexible, to maintain your muscles, etc. To optimizing your sleep, to making sure your relationships are airtight, positive. I'm saying there's a great Harvard study, 75 to 80 years old, study, long-term study on human development, and it showed that having relationships in your life has one of the biggest predictive factors for health and longevity. So and I take that even further. In my masterclass series, the Thrive Formula, I talk not just about relationships, because we popularly think that it's just about another person, but more so it's really about the relationship with yourself. So self-care is really important for those that are healthcare professionals. There is a real thing called physician wellness, physician burnout, physician suicide. Those are real issues. And so it's important to take that time out for yourself, and fill up your own cup. And I think that makes us as better human beings, and I think that makes us as better providers, as better caregivers for others, when we can operate in that vein. I mean, there's just so much more, but yeah, food is usually at the top that we talk about, but it's about making sure that we have a solid foundation all the way around.
And I think the best way to convince people is through, for example, food demos. Any idea if you will go to the conference this year, and will you be involved? Will you be giving a demo or speaking?
Actually, yes, I can say that. So I was invited back to do another culinary medicine workshop, so I'll be there. It's actually going to be the exact same place as 2019, which is the last time I was there. So,
That's right. Okay, so this time I'm going to sign up. And by the way, yeah, as you know, it was supposed to happen here last year. And
mhm.
so I was disappointed that no one came to my city. So
Eventually,
I know, hopefully one day. So you just touched on your master class, the Thrive Formula master class. Can we talk about that? Is it still
yes,
available to people? And
yes,
thank you for inviting myself and Riz to be part of it and to speak about community. So what
yes.
is this program about, and who is it for?
Yeah, so it's basically something that I created, with the mindset that I wish I had something like this when I was in medical school. So most of how I got here was birthed pretty much from my frustrations during medical school. And it's not, I love my alma mater. I think they're doing great work. They even have a lifestyle medicine club, and they, are, just starting a culinary medicine component to their curriculum, which I'm super excited about. And, I've given a couple of speaking events there too as well. So I love them. But, and if it weren't for that, I probably wouldn't have gone through all these detours. But basically, the masterclass series is, again, based off of those 5 pillars. And I have enjoyed a lot of different kinds of conferences, whether it be medical versus personal, growth conferences. And I love traveling. I love connecting. And so I took all those experiences, and I interviewed pretty much around 50 speakers, in their respective pillars. So we have doctors, chefs, dietitians, therapists, coaches, entrepreneurs, just people who are really passionate and really good at their craft. And you and Dr. Riz are there, and I love your contribution to the community pillar. So it's really been a gift and a blessing, and it's a self-paced, evergreen, on-demand educational platform. So there's like 50 plus hours, and you have 3 ways of accessing it. And it's really meant for the people that are health and wellness oriented, on the fence, curious, want to learn at their own pace. We also had it accredited. So, for those that are healthcare providers looking for CME or CNE, you can get medical credits, up to 20 credits, and nursing can also get up to 20 credits as well. We are in a process of trying to get it accredited in other places as well. But it just shows that people are hungry for this type of information. And I wanted to do my own spin on it. And it took me like 7 months to kind of put everything together. But it is something that is, here to stay. And yeah.
And I suppose we'll have a link in the show notes to the
Yeah.
course if people want to sign up.
Yeah, for sure. And I'll give your listeners 15% off, just for participating. So,
Yeah.
because I really want people, I really want to be able to give, because there's so much information out there, right? And everyone claims that they're a health expert. And, pretty much I had to kind of handpick, the people that I wanted to really dispense knowledge, for that I would love to learn from, So, I handpicked, all my speakers to be able to put this series together.
Well, I appreciate that. In a sense, I guess they've been vetted in a sense because sometimes you get somebody on the podcast, and if you haven't done your homework, you're like, whoa, that's a
Yeah.
different perspective than what I encourage people. I also enjoyed listening and learning from other people in the program. I think that you've done a great job. You're really helping to spread the information in a very relaxed manner.
Mm.
So, for example, your Thrive Medicine book. So, I
Hmm.
listen to the audio version of it. So, I take walks on a regular basis. And so that's when I
Hmm.
enjoy a good book.
Hmm.
And you were so open about your life and sharing personal stories. And then also
Hmm.
creating a formula as well in terms of how
Hmm.
people can see the positive side of life in a way
Mm.
so that they can find ways that they can thrive. And so
Mm.
that one, when did you publish that book?
That book was published at the end of 2017, so December 2017. So it's going to be coming up 5 years now.
Wow. And I think I heard you say that there might be a second book.
uh,
Are you working on something?
I'm hoping in the works. In the works. I'm hoping to put out another book, by this year. So
Do you have like a coach or a mentor that has guided you through all of this?
not at all. Everything is DIY. So let me back up for a second. So none of this was planned. The book was never planned. The podcast was never planned. Me doing, getting on the speaker circuit was never planned. the masterclass series never playing. I have zero experience on any of these things, right? I probably failed English and literature in high school many times over. Podcasting, I've never listened to a podcast before starting my podcast. I didn't know what equipment to get. And, we were talking offline. I'm like, how's this new equipment? So it took me a long time to upgrade because I felt like what I was using worked, right? The Chinese is just that, it's like if it works, just, you don't need to bother with it. So we just want to make sure it works. But yeah, I have zero experience in any of that. And I think it's really when that expression, when you have a will, there's a way, right? So if you are really passionate about something and you really enjoy, you feel like there's something about it that you want to give towards others, you'll figure out a way. You'll figure out a way if you know what your purpose, your mission in life is, what your gifts are. You'll find a way to be able to share that, whether it's through music, arts, movies, journaling, whatever. I highly recommend that take the time to cultivate and hone that craft, and make sure that it's authentically you. I think I'm very happy to say that even though I followed a very, very atypical path, I did it in a way that's been the most honest and authentic, to myself, and I didn't have to ask permission, from anyone, and I did it on my own terms. And so it was very important to me that, I did things in a non-regretful way, so no matter the outcome.
Right, no matter the outcome. And it's also gratifying when you're tapping into your own creative side. Now, the podcast, have you ever experienced burnout as a podcaster? And where are you with
Mm.
that today?
So my podcast is called Thrive Bites. It was started in May of 2019. And kind of like the book, I never got to explain my book. My book was, going back to my book real quick second. It's kind of, it's basically, a half memoir, half, self-empowerment type of book. And I really cared about sharing with others on how to thrive. Because I was been up until, writing that book, and still I'm very happy to say is that I've been able to thrive in my own life personally and professionally. So I really needed to put those things down. The podcast, also came about in a very similar vein where, traveling is a huge passion of mine, and traveling, gives me a lot of light bulbs. It helps me to cross paths with people from different kinds of walks of life that I normally wouldn't. And I wanted to kind of share light bulb moments with people. I love conversations. I love really relaxed and casual conversations like we're having right now. It's kind of like coffee, with friends, and just to help people turn on light bulbs, and if I can do that for others, then, why not? So I've pretty much created an interview show to do that. And it's really talking about three things: plant-powered living, enhancing emotional resilience, and creating a thriving mindset. And so we're in our fifth season. At the time of this recording, we just released episode 4 for season 5. And yeah, it's been going strong. I think we have around, I don't know exactly how many episodes. I think we're around like 120 or so, in the one teens, 120, something like that. So I don't really keep count anymore. Once you go past 100, you kind of lose count. And it's been fun. It's been fun. We've tried live streaming with a Q&A in the past. The first 3 seasons were purely audio. And so we kind of shifted and see like, oh, let's see what it'd be like, live streaming and having an audience to Q&A. And, that passed. That was interesting. And then this season, we're still keeping it video and audio, but still we're just pre-recording right now. So, but we're getting a really cool host of lineup of guests for this season. So
I'm glad that you're sort of mentioning it. I wonder how the live streaming went because I was that person that was very afraid to do it, and
mhm.
people were trying to push me to do it. Oh, come on, Maya, you always want everything to be perfect. And it's like, no, I just want to have internet connection. That's all. I just want to, people to actually be able to listen in. And I've seen people struggle with that. So I still have not done that. But also like this, pre-recorded record, it kind of makes it a little bit easier to share
Yeah.
and edit whatever you want to do.
Oh, I didn't answer your question. The burnout a little bit was from the live streaming, actually, because it was a little bit more challenging because you have to be at the same time every week, right? You're hoping that every guest, shows up, right? Internet is good, right? The equipment has not failed. You have good lighting, et cetera, et cetera. And I added on another responsibility in addition to playing host and cameraman. And every behind the scenes was I had to check for comments and check for questions and, kind of put those on the screen and answer them and try to get my guests to answer them at the same time. So that was pretty much a lot more plates to juggle. So it was a lot more stressful than enjoyable, I have to admit. So that's why I've reverted back to just, pre-recording, and it's just more flexible with the scheduling and a little bit more relaxed for me. So,
Same here. I don't know if you can spot my little dog.
oh, is that Poppy?
Yes, that's Papi Chulo. He's asleep right now. I have him so well trained. He knows when mommy's sitting here looking at the camera, I have to be quiet right there, but I cannot do that every day. I have to be very strategic in exercising him, making sure he takes care of his business, feeding him, and all of that so that I can sit here comfortably. So there's no way I can live stream every day. So I know that in the past you have gone to conferences. You
Mm-hmm.
probably get as excited maybe as I
Mm-hmm.
do about the connections that you make. Any plans to attend anything this year? And do you ever plan on giving a lecture or a talk at one of the podcast conferences?
Yeah, yeah, yeah. Good questions. I am attending virtually the podcast. Is it Evolutions or Movement? It's the same company. Later in March. So I'll be doing that virtually, and I've had actually submitted talks before. But podcasting talks are very popular. Everyone wants to do a talk. So I guess, my niche is just very different. So not quite yet, but I have been submitting. So.
We got to figure it out. And so the podcast movement itself this year will be here in Dallas. So I am super excited. It won't be far from where I live. So I plan on
Good.
enjoying that. So, yeah. So you say you have a good lineup of guests this year. I want to focus more and more on mental health.
Mm-hmm.
And one of your key points is emotional resiliency. Do you
Mm-hmm.
want to
Mm-hmm.
talk a little bit about that and what your hopes are in terms of how you want to approach this on the podcast?
For those of you that follow me on social media, I've definitely shared a very vulnerable post not that long ago. And for me, it was kind of everything coming to a head where, you would imagine despair would feel like, over my time, I've battled with, chronic anxiety. I've had depressive moments and, OCD, obsessive compulsive, disorder. And, for me, it's, relating from one human being to another human being, to let people know that, even people you look up to, or, people you think is a professional, or, even you hear this on the media too, like your favorite athlete or musician or, movie star, going down a low point, because we're all human, what I'm saying? And, we are, I think suffering is inevitable. I think it's about how you, I also like to use surfing analogies. So for me, it's like, different kinds of stressors represent, waves of the ocean, right? Small waves, big waves. You have no control on what's coming. The only thing you can do is to practice how well you surf on that surfboard. And every time you get knocked off, as long as you try to get back onto that surfboard, is really the premise of all this. Whether you try to seek out therapy or coaching or, different types of modalities to help you, try to reach out, take the first step, try to, find support and health. And I think that over time, we viewed mental health as very taboo. And I think with the pandemic and with, Black Lives Matter and everything we've faced as a nation, historically, people are, accepting that more and more that, mental health is a huge, growing issue, affecting especially more marginalized, populations. But there's always a way, what I'm saying? So there's always a way, there's always resources out there. You're never alone. You don't have to do it alone. And it's about taking the first steps to really getting yourself, on that path. You just have to, allow yourself. I think the biggest courage and strength is really getting up, getting up and rising up from your lowest point. So,
Thank you for sharing that. And I commented when you made that post, I just really admire you for being so open about your struggles. I love when you said that you wanted to cover that on your podcast. I said, well, this is how we do it by making it safe and kind of normalizing the conversation, like making it normal to talk about these struggles that we have. That I suffer with anxiety. I've had panic disorders or panic attacks in the past. I mean, I can't tell you how many times I've been at the hospital thinking I'm having a heart attack.
hmm
So, you know how, and people being like, oh, here we go again with you. And so I'm in a better place today, but it has taken me seeking help. You're right. We don't know what people live with every day, what battles are
hmm
happening within. So I appreciate you talking about it. And now it's going to be a topic that you cover a little bit more. As it is, you were already covering emotional resiliency.
Oh yeah, yeah, yeah. Definitely covering, but I think it's important, for others to know that, it's important to share, and so I felt like it was right to share, so I just did so.
Yeah, awesome. Wonderful. You love to travel, so you've done missions, medical mission trips.
hmm
And you also combine your running with traveling. So
hmm hmm
I wanted to know where you are in terms of how many states have you covered because you wanted to
hmm
run in all 50 states at one point.
No, that's still the point. That's still the point. So 50 states by 50. So I'll be turning 38 next week. So I've completed 28 states. I've completed 28 states. No, I take that back. I've completed 30 actually. Yeah, yeah, I miscounted. Yeah. Going for another one this year. I'll be in Utah later on this year. And yeah, unfortunately, pandemic has definitely put a damper in terms of traveling. But what I love about traveling, and it's similar to why I love cooking, is the fact that I get to use all my senses and I get to be out, in nature. I think nature for me has been the greatest teacher. Once my parents have been able to give me what they could. To the best of their abilities, right? Me traveling, putting myself out there by myself and literally, like metaphorically and literally, going through the ups and downs. It really teaches you something. And I think lessons are to be learned once you are open and aware of them and you're ready to take them in. And so I've been really blessed and humbled to kind of take in a lot of lessons, hence, my need to write the book, do the podcast and all that stuff. But yeah, traveling was put on a damper for during the pandemic, but definitely looking towards the future and for racing as well, because I love racing with a purpose, especially when I can combine that with traveling as well.
So maybe this has been a time for all of us to kind of rest a little bit from so
hmm
much that we
For
already
sure.
do. Is there anything else that I could have asked, or is anything else you'd like to share with our listeners?
I have a lot of exciting things coming up for this year. So we are hoping to, me and my mother we're actually planning on combining practices together, and actually having an actual in-person, practice. We just moved further down to Southern California. So, we're happy about that. I'm in a new space, new chapter, new energy for this year. This year is definitely, much different than last year. Not so much so because of the where we are with the pandemic, but it's just you just kind of have to be aware of like where you are in life, and understanding of where you align with certain things. And so for me, I do my best to further my work, and most importantly is doing that with others. The Thrive Formula, the slogan for Thrive Formula is ready to thrive, together. And to me, it's really about, you can't really enjoy life without, the support of others, your family, your friends, people that, respect you, admire, things like that. So it's always much more fun to do that. So yeah, we're looking to build a practice. And I also have another project that's, coming out, and crossing fingers if it does, if we get to a certain point that we want to, then we can definitely announce more about it at the conference
Oh,
in lifestyle medicine. So
yes. Wonderful. So many things to look forward to. What is the best way for people to learn more about you, your podcast, your masterclass, all of that?
yeah, so I have two main websites, chefdoczu.com, so ChefDocZhu. That one is my main website where you get to learn a little bit more about me, what I offer, different resources. It's really a platform to kind of help people go to the next step. And so I try to put in as many great resources as I can. I've created a lot of booklets and handouts and just references, so you can find my social media handles from there. The second website is the thriveformula.co. So THR number 5, thethriveformula.co. And again, that gives you access to the educational system. And there is a free session there. So, I do a food demo, and I teach at the same time. The system is really about other guests teaching their stuff, so it's a wealth and body of information. You get credits, like I said, continuing medical and nursing credits, so we're super stoked about that. Yeah, so those are my two main ways of reaching out to me.
Wonderful. And also telehealth. So if individuals, patients would like to see you, do they go to the plant-based telehealth website?
Yes, plantbasedtelehealth.com. I'm there with a team of 9 physicians. We're a team of 9, but we all represent our own private practice. So we partner with Plant-Based Telehealth. Great bunch of people. We are looking to be the biggest, first national lifestyle medicine telehealth company. So we're really excited about that, to be able to, in my opinion, being able to practice lifestyle medicine to its fullest extent. I'm sure Maya, that when you go to these things, you are super educated. You're super, really, really informed from all these great, lecturers, keynotes, and talks. But to me, application wise, there's just so many different ways of applying. And so for me, I was really excited to join with this organization to kind of really just focus on lifestyle medicine and serving that, with others. So we're a team of 9. I'm licensed in California, Texas, New Jersey, Connecticut, Florida, Washington, and West Virginia.
Okay, wonderful. Well, congratulations again for being part of that team. It is a great team. I'm familiar with all of them, and Dr. Lori Marbus and
Mhm.
what she does, and she too has a podcast.
She's brilliant. Yeah.
Yes. So thank you so much, Dr. Colin Zhu, for being with us today. I know that we've been trying to make this happen, and it finally did. And
Hmm.
I'm looking forward to hopefully being in the same space again in the future at a conference or something. Yeah.
Yeah. Yeah. Yeah. That'd be nice. That'd be nice to see the both of you. Yeah.
Thank you again.
All right. Thank you so much.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave us an honest review on Apple Podcasts. That helps us to spread our message. You can also head on over to podinbox.com/HLS to leave me a voicemail. Don't forget to subscribe. And as always, thank you for listening.